Hi, everyone. Hard act to follow, the Minister, but I'm going to talk about a health levy on the manufacturers of sugary drinks. And thank you very much to the collective and Tiff for inviting me to speak about this issue, which has been receiving some attention. And we know that sugary drinks are a problem because they're the leading source of free sugar in the diet of Australians. The World Health Organization recommends to limit the intake of free sugar to reduce the risk of dental caries, excess weight, and type 2 diabetes. So we know that nearly half of the excess sugar in our diets is coming from sugary drinks, and that regular consumption of sugary drinks leads to health problems, including weight gain. So the World Health Organization has recommended that governments implement a levy of at least 20% on sugar-sweetened beverages to increase the price and to incentivise reformulation, as they've done with the UK model. Sugar-sweetened beverages are a broad range of products. They include carbonated soft drinks, which people often are aware contain sugar. But what Australians are not as clear about is that energy drinks, sports drinks, sweetened juice drinks, ready-to-drink teas and coffees, milk-based drinks and waters are also sweetened with free sugars, and Slurpees, which can have very, very high rates of sugar. So this policy is supported by the World Health Organization, who've released a global tax manual on sugary drinks. Last year in December, they also published a policy document which recommended that governments implement this policy. The National Obesity Strategy, 2 years old today, also recommends that the Australian government consider policy approaches that use price to reduce consumption of sugary drinks. We now know that 100 countries in the world have implemented some kind of levy on sugary drinks. Coverage is highest in low and middle income countries, and it's a cost-effective tool to reduce consumption. And it not only has health benefits, it has economic benefits, and it is also equitable. And I'll talk a little bit about that in a minute. So it's, as I said, more than half of the population in the world is covered by sugary drink tax. Young people and low income earners are the most responsive to a price change. And these are the populations who are suffering most from overweight and obesity. They're also, the individual and their family pays the majority of health costs associated with overweight and obesity, higher than government. So if there's reduced health costs and reduced health risks and improved health in these populations, there is a benefit in how much they pay for treatment as well. So that's important. And young people and people on lower incomes are very responsive to price changes. What's happened in the rest of the world? Well, we know from Mexico, which was one of the first countries to introduce a levy, that this had a positive impact on oral health, which is now coming to light with less patient visits for dental cavities recorded after the tax came in. That low income populations were the ones who were most responsive to the tax. So that supported those groups to be healthier, which was really important. In the UK, there was a huge drop in the amount of sugar in drinks. Even before the policy was implemented, consumption of sugary drinks declined. And now there is some evidence that the levy being in place for since 2018 has had some impact on reduction in obesity in some subpopulation groups of children. So that's really important and shows that it's having an effect. Public support is high. In 2017, a survey showed that 3/4 of Australians supported a levy on sugary drinks if the process were used to fund obesity prevention initiatives. And there's certainly lots of ideas on ways that this funding could be spent in the Obesity Collective's budget submission and also in the National Obesity Strategy. This is a widely supported measure. I think importantly, it's supported by the Australian Council of Social Services, but other medical groups such as the AMA, Cancer Council Australia, Diabetes Australia, and the organisation that I lead, the Food for Health Alliance. We've been calling for a levy on sugary drinks for many years now to address the issues. So thank you very much for the opportunity to speak today, and I'll pass on to the next speaker.